I feel like I'm gonna get lost. It's like a coloring book. This is very different than the floor because we are very laid back. Good morning, everyone. It is August 28th. It is a Tuesday. It is my first community clinical. Excited but slightly scared because I feel like I'm gonna get lost. Technically, we are by ourselves because we're all separated in different locations. It is like almost 5:40, so I'm about to leave because it takes 50 minutes to get to the hospital, but in order to figure out where I am, I have to get there a little bit earlier. Stay tuned for the rest of the video. I just made it to the hospital. It's like 6:40, so I have 20 minutes left. I made it safely, didn't get lost. Just finished clinical and I'm now going home. This clinical was actually really fun and cool to learn because I've never heard of it before. It's a small team of 3 nurses and 1 patient navigator. So patient navigators, they educate the patients, give them guidance and support, and empower the patients to make informed decisions. And they also provide them resources for their cancer treatments and clinical trials. They provide information on who to contact, like their surgeon, their doctor, provider, insurance. The main thing that they do is they help patients through barriers that they have, like patient-centered barriers, provider-centered barriers, and health system barriers. Barriers include like transportation, they can't get to their cancer treatment place, financial issues like insurance and what they cover, or having not enough money to pay for cancer treatments, chemos, and all of that. I've learned a lot with the manager and the 3 other people in the team. Like they are separated by tumor related. Like one of them is breast and gynecological cancer, the other one is like lung and pancreatic cancer, and the other one is hematology and solid tumors. So there's that, but they also work together as well. So in the beginning, I had a tour. I did a tour on the resources. So they have like the Sabatco open art studio where patients, families, and staff can go in and they can basically express their feelings or do some cool artwork and paintings. They give you all the materials for free. Then I went to the gym that they have and what they offer for the patients. It's free for the patients as well. And they have meditation room, yoga room. They have a cooking class on how to cook healthy for the patient, like the cancer patients. And then I learned all the tumor related patients to the 3 other members of the team. And then I talked to the patient navigator about the community health and outreach events that they have. And then I talked about the end of life conversations, and we talked about palliative versus hospice and how hospice is comfort focused after you stop aggressive treatments, and palliative is comfort measures with aggressive treatment. And I learned about MOST, which is the medical orders of scope of practice. It also ties in with the whole DNAR and stuff like that. Like all of them made me feel like at home. The manager said that this is very different than the floor because we are very laid back, nothing too crazy, but they do get busy days, and it's like one of those up and coming specialties of nursing, so it's very interesting to learn about that. And I think it's one of those options that I'll definitely put in my mind of when I'm done with just doing the floor work. Now I'm about to go home. One thing that I completely forgot to talk about, guys, is in the open art studio they gave me this. It's like a coloring book for patients and for staff, and I haven't done anything yet, and they gave me like colored pencils, like free colored pencils to keep. Right now I am stuck in traffic on Dallas Tollway It is 4:45, which makes sense because that's rush hour. And I'm starving. I didn't eat that much. I only ate sushi. Since I haven't eaten a lot this whole day, I've decided to eat at Panda Express. I actually haven't been here for like 6 months now. So it's been a long time. I am so hungry right now. I'm about to dive in. So I spent like 2 hours talking to my friends in Panda Express, and then I went to Starbucks to get a pink drink. I forgot to vlog that, but I did. Like, I already finished it. Thank you guys so much for watching. If you want to hear more from me, subscribe to my channel, hit that like button, and I'll see you guys soon.